Good morning, sir.
Good morning.
How are you feeling today?
Yeah, I'm feeling great.
What is your name, sir?
I'm Dr. Dhairyashil Saste. I'm a consultant neurologist at KM Hospital, Pune.
Okay. So, just wanted to understand what is that first thing if I'm a fresher and I have no idea about epilepsy, what is that one thing you would like to explain it to the person? What exactly epilepsy is?
So, epilepsy, as we know, that this is the most dramatic event, and most of the patient they usually have tonic-clonic convulsions. They just have frothing from the mouth. They become unconscious. Sometimes they fall and they have fractures. So, this is one of the most traumatic event of generalized tonic-clonic seizure. So, most of the patient they are aware of this event as a epilepsy, but there are very other types of epilepsies like some of the patient they can have partial seizures, they can have only single limb tonic posturings. Some of the patient they can have only blinking of the eyelids. Some of the patient they can just lose consciousness or can have staring look. So apart from one dramatic event of generalized tonic-clonic seizures, there are some other events also which can be classified into seizures, and this tendency to have these repeated seizures is termed as epilepsy.
Like you just mentioned that we can have symptoms for the patient wherein they are just blinking, and how can the normal person figure out they are going through an attack right now?
So many a times patient in such a partial epilepsy they don't feel the relatives or the caretaker who are around, they feel that patient has some activity arrest. So in between they don't respond, they don't work, they just have staring look. So it's not the patient but the relatives or the caregivers, so they understand this as an epilepsy.
So you're saying the signs basically tell us that they're going through the attack. All right. And what is that funniest myth that you have heard when it comes to epilepsy? What is that one thing in your career you must have heard that you should do this or do that and maybe it can fix?
Of course, this it's not funny, but this is what people actually do. So people will break the onion, they will ask patient to smell the chappals, or they will give some metal object in the hand. So these are the certain things which usually don't help, but this is what patient do. So and we should discourage patient from doing these maneuvers, rather than taking patient to home or to the hospital and taking good treatment, show neurologists, going through EEGs, MRIs, and taking proper treatment.
Okay, so now that it is awareness month for the epilepsy, what is one advice you would like to give it to the audience?
So I will tell audience that epilepsy is treatable. So it's not a taboo. It's not due to some bad karma or bad habits. So it's a disease of brain. There are good treatment modalities, and patients should take advantage of these modalities, and they should spend their life happily.
Thank you so much, sir. Your actually advice really worked. Thank you so much, sir.